So for this week's topic is about dengue, an acute infectious disease that is characterized by a headache, severe joint pain, and rash, and that is caused by a single-stranded RNA virus of the genus Flavivirus or species dengue virus that is transmitted by mosquitoes of the genus Aedes, and it is also called breakbone fever, dandy fever, and dengue fever. Causes. The virus that cause dengue fever are spread by mosquitoes of the species Aedes aegypti and sometimes also called by Aedes albopictus. Aedes mosquitoes are usually found in urban and suburban areas as they like to breed in man-made containers such as tires, flower pots, and household waters. Sign and symptoms. The dengue fever symptoms typically develop between 3 to 14 days after a person is bitten by an infected mosquito. Classic symptoms include fever, headache, and pain behind the eyes, severe muscle and joint pains, which is the source of dengue's nickname breakbone fever. Respiratory symptoms such as cough, sore throat, and nasal congestions. These symptoms usually last for 7 days, at which point the fever breaks. After the fever breaks, it's either the people start to get better or get much worse, developing severe dengue. According to the Health Organization guidelines, any of the following are warning signs that may signal the development of severe dengue, often called dengue hemorrhagic fever, abdominal pain or tenderness, persistent vomiting, lethargy or restlessness, mucosal bleeding such as bleeding gums or nosebleeds, liver enlargement, fluid accumulation in the lungs or abdomen, as shown by X-ray or ultrasound. Dengue hemorrhagic fever is the most serious form of dengue infection. DHF is a clinical syndrome defined by 4 key features. Increase of blood vessels, leading to plasma leakage into the surrounding tissues and lack of plasma in the bloodstream, which makes the blood more concentrated. Low blood platelet count. Fever that lasts for 2 to 7 days. Tendency towards severe hemorrhagic bleeding. Severe bleeding or hemorrhage isn't the most dangerous symptom of DHF. The most life-threatening concern is the leakage of the liquid part of the blood or plasma into tissues surrounding the blood vessels. When this happens, not only can dangerous packets of fluid accumulate where they don't belong, such as in the lungs or abdomen, but also there isn't enough fluid left in the blood vessels to circulate the blood properly. This inability to circulate blood properly is called a shock. Shock is life-threatening and can lead to metabolic problems and organ failure. Treatment of shock requires hospitalization and an intensive care unit for closing monitor, and for the administration of medication that arises blood pressure into normal range.